Anyway, welcome everyone. You're most welcome to this webinar on enhancing parenting practices in humanitarian settings, evidence and strategies, organized by the Alliance Family Strengthening Task Force. My name is Geoffrey Oyat. I work with Save the Children in East and Southern Africa as the Child Protection Advisor. I'm also a co-lead of the Family Strengthening Task Force of the Alliance. Apologies for my colleagues who are unable to be with us here, but I look forward to an interesting 1 hour. Next slide, please. I'll be facilitating this webinar together with Camilla, and then we have set up 5 accomplished presenters who will give us 4 thrilling presentations. And the agenda is set as we will start with an evidence, and the evidence is really a meta-analysis of a number of studies, which we will present as the main presentation. Afterwards, we will go into practice, good practice examples, and we have 2 good practice examples, one from the DRC, presented by IRC, and another from the Middle East, presented by War Child. And we will conclude the presentations looking at the research in humanitarian settings, what, the whats, the whys, the challenges, and we'll promise you we'll have a Q&A at the end. So as we present, and the presentations will be moving quite quickly, if you have a question, please put the questions on the Q&A tab, and the presenters will begin to look at it before the presentations are finalized. Some will be responded to, and others will be collected and presented at the end. So we will then close with a wrap-up. Since we have got quite a tight schedule, next slide. Here we really look at what is the rationale of this topic. We are all aware, those of us who are probably coming here are interested in this topic, that a strong nurturing relationship with a parent, it can really serve as a crucial buffer against the worst impact of any humanitarian crisis. And so in this webinar, we are really going to look at key findings on the effectiveness of parenting interventions in humanitarian settings, because a number of us worry that it cannot be done in humanitarian settings. We'll also look at challenges and strategies on implementation, and finally, some policy recommendations. So to start us off, I would like to invite our first presenter, Dr. Sophia, who works as an assistant professor at the Research Institute for Child Development and Education in the University of Amsterdam. Sophia's research focuses on the effectiveness of interventions to reduce violence against children and the measurement of physical and emotional violence as perpetuated by parents. Her work bridges the psychology, public health, interventions, and research, and focuses largely on evidence synthesis. So join me to welcome Dr. Sophia to give us the first presentation. You're most welcome.
Thank you very much, Geoffrey. Good morning, good afternoon, good evening, everybody. Thank you so much for listening today. Thank you, Geoffrey, for the very nice introduction. It is a real pleasure presenting to you today on the effectiveness of parenting interventions in humanitarian settings within low and middle income countries. So I'm going to present on a systematic review and a meta-analysis that I have conducted with my wonderful co-authors, Dr. Alexandra Blackwell and Professor Francis Gardner. Pedro, next slide, please. But I thought before starting off by presenting the evidence, it would be nice to give you a little introduction into what parenting interventions actually are. So parenting interventions aim to improve parent-child interaction and the general quality of parenting. Parents then practice, but also apply the new skills they learned to their own child and family context. The delivery of these interventions can be to groups of parents or single families, but we also see more and more that there are self-directed formats or technology-enhanced parenting interventions. And from various systematic reviews and meta-analysis and primary studies, we see quite promising effects of parenting interventions worldwide. However, before we conducted this review, we were not so sure about humanitarian settings. And we felt that this setting is very important to look at, as in conflict settings, positive parent-child relationships can protect children against the negative effects of the adverse experiences. Next slide, please. So parenting interventions are actually also supported by the WHO, as represented in the WHO guidelines that were just recently published. And the recommendation 4 within the guidelines states that within humanitarian settings, within low-middle income countries, evidence-based parenting interventions or broader evidence-based intervention that have a parenting component should be made readily accessible. This recommendation is actually based on the review I'm presenting today, but since the publication of the guidelines, we have updated the review. So today I'm going to present a little bit more of an update of the previous review. Next slide, please. So in the guideline development, the WHO, as well as the guideline development group, so basically the panel that advised on the guideline development, asked, are parenting interventions actually effective in these settings? And to answer this question, we chose as a method, a systematic view and a meta-analysis. Next slide, please. But I don't know if everybody's familiar with this methodology, so I thought I'd give you a quick introduction into what systematic reviews and meta-analyses are. So a systematic review is a research method that tries to identify, collate, and also systematically summarize all empirical evidence relevant to a specific research question. Basically, we want to identify all studies that are relevant for our question to be sure to have a good overview of the current evidence base. So for this review, our question was, with parenting intervention, can we identify all eligible studies that evaluated the effectiveness of a parenting intervention in a humanitarian setting within low and middle-income countries? Next slide, please. In a systematic review, you predefine your criteria for the studies you want to include. And we decided that we are only going to include randomized controlled studies. And randomized controlled trials, or RCTs, is an experimental design, and it's also the most rigorous design to use to test the effectiveness of an intervention. And in this design, you randomly assign participants, in this case parents, either to a parenting intervention or to a control condition. And then after the delivery of the intervention, you test if you can see a difference between the parenting intervention and the control condition. We included all RCTs that focused on parenting interventions for parents and caregivers of children aged 0 to 17. So we included quite a broad range also of children. But how did we identify all of these studies? Well, we conducted quite broad and systematic searches. So we searched in 26 databases, of which most of them were international academic literature databases. But we went beyond the pure international databases. We also searched in 14 non-English language databases, which are sometimes more regional databases. We searched grey literature, so that could include, for example, dissertation or master thesis, or reports by, for example, international organizations. And we also searched trial registries, because hopefully and typically RCTs are pre-registered And in that way, we could also identify those studies that have not been published yet. We also searched in multiple languages. So we searched in English, in Spanish, in Chinese, in Farsi, in Thai, and in Russian. And you may wonder why these languages, also in the context of a humanitarian review. What I need to stress here is that the humanitarian review is kind of a sub-review of a much broader low and middle income country parenting review, which we also conducted for the WHO guidelines. So it builds on that review. And if you want to know more about that review, I will also put a link to all the reviews we've conducted, which are open access. And then you can also read our findings about the general evidence base for parenting interventions globally, but also for low and middle income countries. Next slide, please. So after all these extensive searches and months of work and screening through articles and titles, we actually identified 23 randomized controlled trials from 16 different countries. And you can see the countries on the bottom of this slide, ranging from Bosnia and Herzegovina to Uganda. These 23 different studies examined 19 different parenting programs, of which 61%, so a bit more than half, were homegrown. What does it mean? Homegrown interventions are interventions that have been developed but also tested in the same country, whereas the remaining 39% were transported intervention. So they have been developed in a different setting and then transported to this setting where the intervention was tested in. There are different levels of prevention, and for these interventions, most of them followed a selective prevention approach by including parents or families at risk for child behavior problems or adversive parenting techniques. So most of them were that, but then 2 of them focused on parents that already used some corporal punishment in their parenting practices and specifically selected those families for inclusion. Next slide, please. So what kind of families and interventions were within these 23 studies? So most families were poor and often living in context of adversity. Most of the interventions were delivered as part of a group format. So having this intervention delivered to multiple parents at the same time by one facilitator. Most interventions were delivered in public settings, but we also saw some interventions being delivered in the home, school, or even healthcare setting. The interventions followed multiple aims, such as improving parenting or family functioning, improving the well-being of parents or children, improving parenting confidence or even stress management techniques, or reducing family conflict, harmful gender norms, or violent parenting. The delivery of this intervention was conducted either by lay workers or semi or professional staff. So there was also quite a range of different delivery agents. And on average, 68% of the content of these interventions focused on parenting. In this review, we also included interventions that had a minimum of 20% of the content being focused on parenting. We did that because we saw that in humanitarian settings, many interventions are delivered as multi-layer interventions. So we wanted to ensure that we also include those in this review. And most of the interventions targeted parents. There were 5 interventions that had as an additional target children, or mainly adolescents. Next slide, please. So, do these interventions work? So here you see multiple outcomes that we focused on in our review, ranging from reducing violent parenting practices to improving child behavior. You see here different numbers. You see the number of studies. You see the number of effect sizes, so the number of outcomes that were included, and the effect size. So first of all, what you can see is that not each study measured all outcomes. As a reminder, we had 23 studies included, but 14 of those measured physical and emotional violent parenting practice. So what did we find within those 14 studies? They actually did reduce, with quite a solid effect size, violent parenting. So yes, parenting interventions in these settings can reduce violent parenting techniques, particularly physical and emotional violence. With quite a good effect size for social intervention, we see these interventions improve positive and nurturing parenting strategies, reduce negative parenting practices. They can even improve the mental health of parents by decreasing depressive or anxious symptoms within parents. But the same applies also to children, where we see a reduction in internalizing behaviors, such as, for example, withdrawn, anxious, or depressive symptoms. Surprisingly, which is not in alignment with the global evidence, we could not find reductions in externalizing child behaviors within those settings. We have some hypotheses, but they need to still be tested of why this might be the case. Next slide, please. So what can we conclude from this? First of all, we can conclude, and that was also the conclusion of the guideline development group, that parenting interventions effectively reduce a multitude of adverse outcomes in families that are living in humanitarian settings in low and middle-income countries, and they can also improve positive parenting strategies. However, as a researcher, it is also my duty to talk about the limitations of our work. One is that the studies came from a multitude of contexts. So we include here studies that have been implemented within a war zone or with displaced populations in a new context or in a post-conflict setting. And also, yes, we found 23 studies, but also you saw in the outcome table that not each outcome was captured by all 23 studies. So sometimes our estimates of how effective an interventions are based on a limited number of studies. So we need more studies. And what we would like to do also with these studies to test whether these interventions actually work in all different contexts and for all parents equally. There is a chance that it could be that certain characteristics associated with the child or the parent, the intervention, the components of the intervention, how it was delivered, by whom, all of these could impact the effectiveness of our interventions. So we would like to shed a bit more light on that, but for that, we first need to have a few more studies. Next slide, please. Thank you very much for listening. I put my email address there, but I don't know if it's very visible, so I will also put it in the chat. And you can find our published review with much more information on what kind of interventions were included, in which kind of settings, in which countries, in this publication. It is open access, so you can scan the QR code with your phone now, but I will also put a link in the chat right after this presentation. Thank you very much for listening. Please feel free to ask as many questions as you have, and I will try my very best to answer them. Thank you.
Yeah, so thank you very much, Dr. Sophia, for laying the groundwork and indeed ably making the presentation from a number of studies in their meta-analysis that parenting interventions actually do work, even in humanitarian settings, and there are a number of positive outcomes, not just in reduction of violent parenting, but also in the well-being of the parents and caregivers themselves. So this sets the scene for us. Our next presentation will really take us into some practical examples of what good practice is happening. And I would like to welcome Yvonne Agemo from the International Rescue Committee, who will give us a presentation. Yvonne is the global lead for child protection at the International Rescue Committee, and she's based in Geneva. She is also working on parenting in humanitarian settings research of IRC together with the University of Oxford. She is an accomplished child protection worker with international experience from multiple regions in East and Central Africa, Middle East, as well as Asia. So join me in welcoming Yvonne, who will take us through and give us good practice from IRC in the DRC. Thank you.
Thanks. Thank you, Geoffrey. Pedro, I hope you can put the slides up. And I'm going to share about IRC's Families Make the Difference intervention, which is one of the interventions that was included in the review that Sophia conducted. I would also like to say that I'm speaking about the good work that my colleagues based in the different countries where IRC is present are doing the implementation. So this is really speaking on behalf of my colleagues, the good work that they do. And I hope that some of them are here on the call and can attest to what they're doing already in the different country programs. So the Families Make a Difference intervention, which has been translated into French, Arabic, Spanish, is available in our website. Can be downloaded. So again, I'm hoping that some of you have seen it, and what I'm going to speak about is not very new to some of you. We can move to the next slide. I'm speaking about Congo, the Democratic Republic of Congo. It's a context where we see that parenting interventions are really making a difference and is important. I think we are aware that there is a current crisis and this recurrent conflict setting. So we do know that in such a context, the need to support parents and the need to work with caregivers to support children continues to be a high priority. So from evidence to practice, I would like to emphasize that some of translation of evidence to practice takes time. So Parents Make the Difference is the intervention that IRC evaluated. And I think our first study was in 2015, 2016. We are implementing this intervention in 31 countries, currently in 2025. So by the time we're having the results of the trial to the time we're doing the implementation, it's been 10 years. And it's been 10 years of learning some of the things that we know worked in particular contexts. And now we know that there are some gaps, which again, we're trying to refine because we have a system of monitoring and evaluation that I'm going to speak to you about. So the intervention was tested in Burundi, Liberia, and Thailand. Based on learning and the gaps that we've seen, this intervention also informed part of what we do within our Women's Protection and Empowerment Program. So we do have an intervention that is looking at the core occurrence of child maltreatment and IPV, which is safe at home, and it's also one of the interventions that was included in the review. So again, encourage you to look to read the review that Sophia spoke about to see what safe at home is about. And this is one of the gaps that we see once we have a study and the trial is complete. We have the results. In the implementation, we see that there are some gaps and there are some other forms of violence that we still need to continue to refine our interventions to be able to address. I'll continue to the next slide, Pedro, please. So the outcomes that we are looking at in the Families Make a Difference intervention, which we have adapted for the different contexts where we implement, is reduction of violence against children, and also looking at caregivers' well-being and mental health. We know that the caregivers do provide that protective environment for the child. And so the well-being of the caregiver, that's what we hypothesize, the well-being of the caregiver is really important to providing that protective care for the child and reducing violence against children. I want to read the different outcomes the different competencies that we are looking at. But again, in a nutshell, is really the parent-child interaction, communication, and the parent guiding the child. All this with the aim of these two outcomes, violence reduction and improving caregivers and well-being of the parents in the home. Next slide, please. This is how the intervention looks like. Just very quickly, we have 13 sessions, 2 hours. It's face-to-face, so we haven't done remote delivery, but this is something that we're looking at as some of the adaptations that we will be doing. And one thing that we have not consistently done is the home visits. The intervention was designed for us to include a home visit component, but due to the implementation challenges, how expensive it is to conduct home visits, and insecurity in crisis settings. This is one of the areas that we have sort of not implemented, and we're still seeing results in terms of reduction in outcomes. So it has become an optional part of our implementation. I'll now quickly speak about how we measure outcomes so that we can continue to see if we are seeing reduction in violence against children, or if there's anything that we need to adjust. Pedro, let's move 2 slides. I'll skip the content and encourage you to look at the intervention just because of time. This is our teams in the DRC, where we do the context adaptation, community engagement, and this is really typically how you'd go about doing the implementation of a parenting intervention. Training of the teams, and then a separate training for the M&E team so that we can measure outcomes consistently. How does it look like then in terms of measuring of outcomes? If we could move to the next slide, please. So this is the meal path, and we normally start with the facilitator pre-post because we want to make sure that the facilitators implementing the intervention are well-versed with the content and can deliver quality. So really, fidelity to the intervention is very important. We do have step 3 there. You can see a pre-questionnaire, which is a pre-test that we administer to the parents. And then at the end, as you can see there in step 7, there's also a post-test. And this helps us to measure outcomes at the end of the intervention. In between, we have session observation, which is part of supervision, so that we can reinforce any skills that we see missing from or anything that needs to be strengthened in terms of facilitation and guiding the discussions with the parents. I may have finished my 5 minutes, so I'll quickly go to the last slide. This is a snapshot of a dashboard that we have across all our country programs. We measure outcomes systematically and consistently. So each country program where we're implementing the intervention, we have the dashboard so that at a global overview, we are able to see whether there's any reduction in violence against children, or if there's any particular outcome we're hoping to see, but we don't, then we're able to question, is there anything we're doing differently, or is there anything that needs to be adjusted for the context? I'll stop there. I think Geoffrey would like to stop me because we're at time, and I'll skip the slide on challenges. I think that might come up in terms of questions if anyone would like to know some of the things that we've struggled with and how we've gone about adjusting our interventions. Thank you.
Okay, thank you, Yvonne. Apologies for the time. Participants, these materials will be available, and we encourage you to search. So we will quickly go to our next good practice. And this is coming from War Child Alliance, and Hiba is presenting for us. Hiba is a Palestinian professional with the background on counseling and a master's degree in community mental health. She really has extensive experience in the Middle East, working on both child protection and MHPSS, and she's currently the MENA Regional MHPSS Advisor for War Child Alliance. So Hiba will present for us an intervention called Be There. You're most welcome.
Hi, everyone. So this is Hiba, and I will be talking today about Be There intervention, which we used to call it before caregiver support intervention. For this intervention, it has been designed to be implemented with the caregivers of the children coming who experienced war, conflict, became refugees, and so on. If you can go to the next slide, please. As you know, most of these caregivers or parents of the children have experienced very difficult conditions, such as the loss of family, constant danger, loss of income, loss of their homes and possessions, and so on. If you can also go to next slide. And even after escaping war or living in refugee community, the stress is still ongoing because they are also facing new realities, maybe unable to work, having inadequate housing. They have worries about their safety and their children's. So we thought that they can maybe benefit from a safe, supportive place where they can share their worries and challenges, feel supported, learn some helpful techniques to lower their stress and also relax their minds, and also some positive parenting practices. Next slide, please. So for this intervention, we used the term caregivers because we wanted to include all the caregivers taking care of the children, including, for example, for some children, it's not the father or the mother who are taking care of them. Sometimes it's the aunts, the uncles, cousins, some relatives. So that's why we used this term. Next slide. So the goal of this intervention is to help caregivers feel supported, valued and respected, also learn some ways to lower their stress, learn how to manage and reduce anger and frustration, develop some new skills for raising kids in difficult circumstances, learn to avoid also taking stress out on their loved ones and on their children. Next slide. So this intervention, it is to give the caregiver safe space, safe place to look together at the impact of stress, encourage caregivers, share ideas and solutions to common challenges, and learn some simple techniques to manage their stress, but it's not for diagnosing any psychological disorder or providing individual group therapy or psychotherapy or for treatment in any way. Next slide, please. Yeah, so for this intervention, it's a group intervention that consists of 10 to 12 people. The gender here, it's usually separate. So we have male groups separately from the female groups, usually, depending on the norms and the cultures in some contexts. The number of sessions are 9 sessions. Duration, it's 2 hours, and they meet once per week with a total of 9 weeks. Next slide, please. So it's for parents and other caregivers, as we said, with at least one child between the age of 0 to 12 years old. Next slide, please. So this is briefly how the program is structured. So from session 1 to 4, it's about caregivers' well-being and stress management, dealing with anger and so on. From session 5 to 9, it focuses on parenting in adversity and on also teaching some positive parenting techniques. And session 9, it's a recap for all the sessions. Next slide. This is the session structure, the session itself. So it starts with energizer, review of home practice, which is usually a relaxation exercise that they had to do at home. Then main topic, sometimes also it continues with an additional exercise related to the main topic. Then they practice together relaxation technique, and then assignment for the next meeting. Next slide. Thank you. So for the successes of this intervention, we can say briefly that as we heard from the parents and the caregivers themselves, it helped create a safe, supportive space to share experiences and challenges. Also, caregivers demonstrated increased awareness of their stress and emotional well-being, improvement in their ability to manage stress. The intervention also fostered strong peer support among the caregivers themselves. Caregivers actively engaged in discussion and meaningful discussions and exercises. By the end of the intervention, also caregivers shared success stories with us, reported the noticeable shift from harsh parenting towards more positive practices. Next slide, please. So yeah, this is about the challenges, and most of the challenges we had were related to the male groups, because the attendance rate was better in the female groups, the mothers and the female caregivers. And this is because of the norms in some contexts and the culture. And yeah, so for different reasons, we had more groups of female or mothers than the male groups. The attendance consistency also, sometimes it was not easy for the caregivers to commit to the 9 sessions due to obligation and different competing priorities. Sometimes we also were facing difficulties or challenges in referring parents in needs for further support or in-depth support. So because of the limited services available, the security instability also in some contexts, or because of the conflict, caused some delays sometimes in the sessions or cancellation. And there was also a feedback that we kept hearing from the parents that they need further MHPSS support, but they also have financial needs, and they need also livelihood opportunities. So those socioeconomic challenges beside the mental health support. Yeah, so I think I wanted to also talk about some of the research data, but I think my timing is has finished. So yeah, thanks a lot. Yeah, that's it.
Yeah, thank you, Hiba, for that quite interesting approach which you are implementing. So our next presenters, we have 2 presenters from the Global Parenting Initiative, who are going to be really talking to us about research again, whether it's possible or not. So we have 2 able presenters, Dr. Ihsan and Dr. Alaa. So Dr. Ihsan works at the University of Oxford, Department of Social Policy and Intervention, where she serves as head of advocacy at the Global Parenting Initiative. And in this role, she really drives the uptake of this evidence-based parenting. And recently, she managed the group's parenting response in Ukraine, Pakistan, Syria, and Turkey. She will be co-presenting with Dr. Elkani, who works as a humanitarian psychologist and MHPSS specialist at the United Nations Office of Drugs and Crime. And she has authored numerous MHPSS and trauma recovery, family skills, and parenting interventions. So over to the 2 colleagues to take us over the next 5 minutes, and then we'll remain with some 10 minutes for Q&A. Thank you.
Thank you so much, Jeffrey. And hi, everyone. Thank you so much for joining us. I'm absolutely delighted to be here today. And with my lovely colleague, Dr. Alaa Elkani, I will be presenting on conducting research in a humanitarian context. The next slide, please. There has been an increase in incidents of natural disasters, health emergencies, and armed conflicts globally. And humanitarian crises have tremendous adverse impacts on children and families as they witness and experience displacement, hardships and financial stress, separation, violence, and even death. Also, the high level of stress for parents and caregivers typically lead to an increased harsh parenting and violence against children. But as previous presenters have already shared, the good news is that families in crisis settings can be supported with interventions that provide mental health and psychosocial support for parents and caregivers and skill them to improve parenting behaviors and support their children to cope during crisis. However, there is need for research to assess the effectiveness of interventions, identifying successes and areas for improvement to optimize future interventions, identify the most effective strategies for delivering aid and services, and get insights into the specific needs, challenges, and cultural dynamics of affected populations to ensure more relevant and impactful responses. The next slide, please. So the Parenting for Lifelong Health team, in collaboration with UN agencies, including the UNODC, where my colleague Dr. Ala works, and other international organizations, developed and disseminated parenting resources to support families affected by several humanitarian crises, including the Ukraine conflict and the 2022 climate crisis in Pakistan. You can use the QR code on this slide and the links here as well to read up more about these different parenting in crisis responses that we had. And we subsequently evaluated the implementation of the intervention in the Ukraine and Pakistan context. So based on these studies, we will share insights, specifically challenges and facilitators in conducting a study in humanitarian context. The next slide, please. The next slide, please. So conducting research in humanitarian settings comes with several challenges. Researchers must navigate ethical approvals, limited access to affected populations, language and cultural barriers, unstable infrastructure, the complexities of obtaining informed consent from already distressed participants, and other challenges, some of which are listed on this slide. Yet, our experience proves that with the right strategies, rigorous and impactful research can still be achieved. And with that, I'm going to hand over to my wonderful colleague, Ala, who will share facilitators, key facilitators for success in humanitarian research. Over to you, Ala.
Next slide, please. Thank you so much, Ihsan. Good afternoon, everyone. And thank you, Jeffrey, for the introduction. Now, research in humanitarian settings has massively expanded in the past decade. And with this comes many lessons learned on the facilitators that have made this research feasible. I'm going to share with you both some specific examples of key facilitators our research team has used, and then some more general ones. Next slide, please. Number one, it's really important to ensure a flexible approach is set out in your ethical application, which allows for anticipation of challenges that can be faced that might hinder your research. For example, in 2015, I was conducting research in refugee camps in Syria, and my ethics application had specified I had to wait 24 hours between giving families information on the study I was conducting and then being able to interview them. And this was a significant barrier to my data collection, as when I got to the camps, I realized I can only enter each camp once. I ended up having to go back to the UK, where I submitted an amendment for my ethics application to remove this 24 hours, going back to the refugee camps a second time, and this was a much more straightforward process where I could meet families and interview them immediately. So anticipating the more specific challenges of humanitarian settings is really important, and we can only really do this when we work closely with field teams to develop our study protocol and ethics application. Slide 2, please. So a second major facilitator is to collect data through existing aid supply routes. So really explore what's already being delivered to family and piggyback onto these routes. For example, in 2014, we conducted a study in Syria to explore the feasibility and engagement of delivering parenting leaflets in an active war zone. And back then, the only supplies that families were receiving were bread that they would collect daily from just one bakery. So we inserted both a parenting leaflet, a study information sheet, and questionnaires, along with a pen to complete the questionnaires, into these bread wraps. And as families picked up their daily bread, they received the research tools. And then the next day, when they came back to pick up their next supply of bread, they were able to drop off the completed questionnaires. And we were astonished at the response rate of almost 60% of families completing the questionnaires, even in a war zone. Next slide, please. Another facilitator is to utilize online data collection tools when possible. For example, in the recent Ukraine study that Ihsan referred to, we collected data through families using an online QR code to access questions that they could complete on their phone. In other cases, basic Google Forms, which are really easy to set up to collect data. And parenting tools are often disseminated online or through apps. And here we have lots of information on engagement and access that we can gather from the back data of these apps and websites. Next slide, please. And of course, there are many other facilitators too, such as building strong partnerships on the ground, ensuring you have a clear communication strategy, and co-designing research to ensure tools and content are culturally relevant and acceptable. So in conclusion, though humanitarian settings do pose many challenges for research, it is feasible to conduct the necessary ethical research to further expand evidence base of family skills research in humanitarian settings. Next slide, please. Thank you. And we'd be really happy to take any questions. And next slide, please. Thank you very much.
Thank you to our presenters, to all the wonderful presenters. We really started with a meta-analysis, which told us the effectiveness of parenting interventions in humanitarian settings. We saw 2 evidence-based program examples from the DRC, as we concluded by looking at that it's to answer some of the questions which are normally prevalent, that, okay, you can't go in there in a humanitarian crisis and collect information to see effectiveness of those methods. And our colleagues in the last presentation from the Global Parenting Initiative did give us useful information. So we will now go for the Q&A, and I hope some questions did come in. I will hand over to my colleague Camilla to facilitate these sessions. And if some questions have already come, we can have a look at that, and you can direct them accordingly to the different presenters. Thank you.
Fantastic. Thanks so much, Geoffrey, and thanks so much to all of our speakers. I've learned a lot, and I'm sure the participants have as well. There's one question that we haven't yet written a response to, so I'll go with that first. And if others want to come off mic and then complement what they've written in response to the other questions, that's very welcome. So the question's from Vanessa. How do you work with other sectors, health, MHPSS, food security, etc., for the unmet needs, health, economic, that also impact caregiving practices? Have you implemented a multi-sectoral integrated approach? I'm not sure if that is something that any of our speakers, maybe Hiba, can speak to. So come on in, Hiba.
Yeah, I think the question was directed for me, I think so. So for All Child, we focus actually on child protection, MHPSS, and education. So these are the main sectors. So we try as much as possible to have integrated the programming that include or combine the 3 components. But we also try by coordinating, and in some projects also have some programs that include livelihood as well. Through coordination and some project consortiums with other organizations, we try to refer the caregivers to the needed, let's say, service, either health, mental health, socioeconomic, depending on the needs.
Fantastic. So yes, it's clearly a need, and great to be able to set up referral systems when the other services are there to refer into if they can't be provided directly. Okay, so for Sophia, I have a question for you. So you said that you did a wider study on parenting interventions in lower middle income contexts, and this humanitarian findings that you shared with us is a sort of piece of that you've pulled out. So I wanted to ask you a question on, were there any differences? I mean, maybe I missed it, but maybe if you covered it, but quickly, you can say a little bit more about that. Thanks.
Yeah, thank you. That's a great question. So in terms of differences, not so much. We saw very similar results, but we saw much more studies in the broader LMIC context. So I think over 130 studies, so quite a big review. And with that came also more outcomes we could examine. So we first of all found that also parenting stress, parenting efficacy improved, and even child ADHD symptoms. And in terms of the finding for externalizing behaviors, we could not find the same in LMIC. So we did find effects for that these interventions do reduce externalizing behaviors in children in general LMIC studies. So really mirroring the other global evidence we know.
Fantastic to know that it's working in humanitarian contexts. So despite all of those challenges we've heard about in terms of conducting programs, conducting research in humanitarian contexts, we still can achieve results for children and families. That's great. Okay, so I see Yvonne has answered one of the questions I think was directed to her around adolescence in the chat. I think there's another question that's just popped up in the chat box, Yvonne, probably directed towards you from Michaela, which is, could you provide some information on the M&E mechanism and how to measure changes on in parenting programs? So perhaps you can pick up on a bit more on the M&E side. Thanks.
Yep. Thanks, Camilla, and thanks for the question. So we have our M&E teams that have developed for us our M&E framework, which includes all the standardized measures that we use for the intervention. It's largely the UNICEF mix. And then we do also have standardized satisfaction surveys. When I was presenting, I very quickly mentioned the pre-post that we do with parents and also adolescents, but with younger children under age of 10, we do not do any M&E in terms of the changes that they see. So this is really about self-reporting from the parents. So consistently, this is we do the questionnaires. We have an M&E team that is independent from the facilitators who do the pre-test. And then at the end of the intervention, we do measure results up to 3 months post-intervention. Again, because of the context and stretched budgets, we do not have the luxury and the quality luxury to come 1 year later to see if the effects are sustained over time. So most of our measures really are up to 3 months post-intervention. The M&E guidance is really standardized again to help us measure these outcomes across different countries. And with this, I can confidently say that consistently we see positive parenting strategies. We see consistently reduction in harsh discipline across all the different countries where we do have the intervention. So it's really powerful to see that across the different settings, we are seeing reduction in outcomes that are as expected in terms of the intervention. Just quickly, I think it's important to also say that to acknowledge that parenting interventions cannot address all forms of violence against children in humanitarian settings. It will not address everything. So one of the things that we saw in terms of the feedback from parents, specifically in DRC, the Central African Republic, was the need to adapt something specific for child recruitment. So we have developed, and again, this is feedback from consistent M&E and systematically collected and analyzed. We saw that there's a need to develop something that is different to address, to support caregivers of children who've been formally recruited into armed groups. So this is another intervention that we have designed. Again, it's publicly available. We've done a formative research and are gearing up to conduct the RCT with some of the researchers that are I think some of them are here in the webinar. So again, I think the message is that one intervention cannot address all forms of violence against children through parenting in humanitarian settings. So consistent M&E can help us to see what actually difference we can make and what we need to adapt and do differently for other forms of violence against children.
And it's fantastic to know you've been doing this evidence-based work so that we can be really explaining the outcomes of our programming in these current times where that's what donors are asking us for, and we're looking for different organisations to step up and fund this important work. Okay, we're really up against time. There was one other question, Geoffrey, in the chat box from Rahinatu around approaches to research that I felt we could potentially answer live. There's 2 others that I think, Geoffrey, you can potentially pick up on regarding other webinars from the Family Strengthening Task Force. So perhaps I'll hand to you to see how best to wrap up with the time we have left. And thanks very much. If that doesn't put you on the spot.
Thank you, Camilla, for facilitating that. Yes, there are a number of challenges with parenting, programming in general, because it's time consuming, and when you are doing it in humanitarian setting, it's even much more difficult because the parents are facing many other challenges. And right now, with the challenges with funding, and I see a question from Ramjini there, there's a move to deprioritize some of the parenting interventions in humanitarian settings, and yet we see that because of the challenges for both children and parents, it is even now more crucial that should be emphasized. So I would really like to say thank you very much for all the presenters. Sharing this knowledge is quite important. We have seen that parenting interventions do make a difference. We have seen that there are some good practice. We just presented 2, and I know there are so many out there which can be tested. But we have also seen that it's important to really systematically evaluate these methods, conduct research, so that we can present evidence to donors and other actors that these methodologies do work. In the ministerial conference, which happened at the close of last year in Colombia, parenting came out as one of the key areas in response to the EVAC processes and reduction of violence against children. We got pledges from many governments, and a number of our colleagues working in development settings are working on that in following up the pledges. For those of us working in humanitarian settings, we need to get interested in the different contexts where we are working, so that we join up and follow up the pledges, so that the benefits of these pledges do end up in humanitarian context as well. Look out for other events from the Family Strengthening Task Force, which is coming up. We will advertise them soon. And we do thank over 120 of you who participated today, and look forward to you coming for our next session. Thank you very much. Thanks once more to the presenters, facilitators, as well as participants. That's all for today. Thanks.